Dr. Sumayah Taliaferro. She lives in Atlanta, Georgia. She is a board-certified dermatologist and a Brown University graduate. She is the owner of Atlanta Dermatology and Aesthetics, and she has expertise in a variety of pigmentary disorders, medical dermatology, surgery, cosmetic dermatology, and the list goes on, as you can see. So I'm very excited to hear what Dr. Sumayah Taliaferro is going to share with us today. So I'm going to pass it over to you.
Good morning, everyone. Thank you for inviting me to the Women's Conference on focusing on hope, health, and healing. It's my pleasure to be here. I thought as a dermatologist, I'd bring to you just some tips on gorgeous, youthful skin for a lifetime. So I'd bring some anti-aging pearls specifically as how it relates to the skin. So we all love it when people say, you're glowing, or your skin looks beautiful, or you don't look your age. Well, most of that has to do with basically your overall wellness. So your diet, sleep habits, exercise, your confidence, your personality, your outlook on life, your spirituality, even the joy you give to others. So your essence in a sense. However, we know that a large part of it is also our outward beauty, and a large part of that has to do with the skin. So my tip number one for you is to know your skin type. And there are 3 basic types. So the first type is oily. Second type is normal to combination, which is not exactly the same thing, but they tend to be grouped together. And the third type is dry. So how do you tell what your skin type is? It's a question I get daily. Well, if any point during the day, you can take the back of your hand, rub it across your forehead, and you feel oil or greasiness, then you more than likely have oily skin. Most of my patients who have oily skin, they know it. They don't even have to ask me. That's one of the most common skin types that I see, because oily skin types tend to be prone to breakouts as well. Also, oily skin types tend to have a shiny appearance that lasts throughout the day. Often that's a telltale sign. Normal skin patients generally don't experience breakouts. So, they rarely experience breakouts. They're quite fortunate. Patients who have combination skin, however, can experience occasional breakouts, and they tend to have an oiliness that's confined mostly to the T-zone. So they'll often have sometimes breakouts occasionally as well. And those patients, sometimes it's tricky because some things will dry their skin out and some things will make it too oily. And then the dry skin type is rather easy as well, because most patients who have dry skin, their skin soaks up moisturizers and they can be prone to dry patches from time to time. The next important consideration is whether or not your skin is sensitive. So this brings us to the subtypes. So do you have oily sensitive skin, or combination sensitive skin, or dry sensitive skin? And the way you can tell that is primarily how your skin responds to products. So do you have irritation, burning, itching, stinginess that may occur from certain products? Then sometimes you'll know that perhaps you have sensitive skin, especially if this develops rather frequently. Also, you can tell if you have sensitive skin sometimes if your skin is frequently red, if it frequently turns red. So you want to ask yourself these basic questions, and then you'll be well on your way to determining what your skin type is. And that's my tip number one. Also, the internet can help us here, because there are many, many different types of little quizzes online that can easily tell you what your skin type is. So this brings me to my tip number 2. My tip number 2 is, and most of these tips you have heard before, but I'm just going to try to offer some explanations for why they're important. Tip number 2 is to find a good sunscreen. And most patients, especially my patients of color, will ask me, why in the world do I really, really need to wear sunscreen? And it's a really good question, actually. So the first important reason is for protection against UV light, is protection against the sun. And people of color actually have a natural SPF of 7. And so again, my patients of color will often ask, well, I'm not at high risk for skin cancer, so why do I need to wear sunscreen? Well, first of all, a natural SPF of 7 doesn't protect you from high intensity UV light. And high intensity UV light can actually cause mutations in the skin cells. And these mutations can lead to abnormal cell growth and skin cancer. So one of the most important reasons for wearing sunscreen, of course, is to protect against skin cancer. The second reason to protect against skin cancer, to protect against UV light with sunscreen is because sunscreen protects against collagen breakdown. And as we age, naturally our collagen is broken down by these enzymes called collagenases, and it's a natural phenomenon. However, it is intensified by UV light, and it can be premature and lead to much, much early aging if you don't protect yourself against the sun. So as we age, naturally our collagen breaks down, but we want to slow it down. So wearing sunscreen can actually slow it down. And collagen is really kind of what keeps our skin nice and taut. So if you compare our skin to a baby's skin, for example, adult skin has aged mainly because of the breakdown of collagen. So this leads to the sagging, the crepiness, and even sort of the leathery appearance that we sometimes see with aging skin. And sunscreen prevents that. Excessive UV light also overstimulates melanocytes. So the third reason for wearing sunscreen is to decrease hyperpigmentation. And this can help us to maintain an even skin tone. Often the patients that I see, we actually may not age as rapidly because, again, we have a natural SPF of 7, patients of color do. And so they may not be developing the decrease in collagen causing a lot of wrinkles early. But I do get complaints on an absolute daily basis for hyperpigmentation and an uneven skin tone. So I tell my patients that one of the best ways to protect against an uneven skin tone, to correct an uneven skin tone, to improve an uneven skin tone, is to make sure you wear a sunscreen. And you know, a lot of one of my pearls about sunscreen that I spend a lot of time on in the office is trying to select one that actually you're going to wear, because the best product is the one you're actually going to put on. And to increase compliance on that, I try to work with patients to make sure it's one that actually agrees with their skin. And that's why it's important to know your skin type. So your tip number 3 is to select a good anti-aging product. And the anti-aging products are a long list, actually. So I wanted to walk through that with you a little bit. So often we'll see retinol, retinoic acid in anti-aging products or anti-wrinkle products. Olay just came out with a product that's Olay retinol. And retinol is so important to dermatologists because it has the greatest scientific evidence in terms of how many research studies have been done. You can look at many different studies on anti-aging of the skin, and retinol is going to come up because retinol has been scientifically proven to improve the skin in many, many ways. And so it has an anti-aging benefit. Primarily, I'll just discuss how it has an anti-aging benefit in that it decreases the breakdown of collagen. Of course, retinol is also helpful for preventing breakouts. It helps to even out the skin as well. So all of this is supported in the medical literature. So you don't have to take my word for it. You can look it up. But the reason why some of these basic tips you'll hear over and over again, is because it actually has some data to truly support why you should, follow those rules. So retinol is a key ingredient, glycolic acid or alpha hydroxy acids, anti-aging peptides, growth factors, antioxidants, and high hyaluronic acid. So these are all buzzwords, and I'll go through them rather quickly. So glycolic acid and alpha hydroxy acids exfoliate the skin, but they also have an anti-aging benefit that's not been fully elucidated. It helps to smooth out the texture of the skin. It certainly helps to exfoliate the skin and lift away uneven, a lot of the hyperpigmentation, and so that helps to even out the skin. And then anti-aging peptides have work on a cellular level. They'll actually enter the cells and increase collagen production. So I used to wonder in some anti-aging products, if it didn't contain retinol, well, what does it actually contain? And some of them actually contain anti-aging peptides. So they have an effect that's similar to retinol, but it's not as abrasive and not as irritating. There are many patients, particularly if you have skin type, sensitive skin, which is important to know your skin type, who will be very irritated from some of these products. So you do have to be careful and get some professional advice at times. Growth factors came on the scene a few years ago, and it was very helpful, particularly to patients who did not tolerate retinol or Retin-A or some of these other anti-aging products. They found those, for sensitive skin patients especially, they found them to be too irritating, too drying as well. So for patients who had dry skin, they used to have a hard time sometimes with that key product. And they wanted to use that product because they knew that there was evidence that actually showed that it actually did something. But growth factors sort of changed the game. And I think of growth factors as sort of food for the skin. And I used to say it's like kale for the skin, because it has an anti-aging benefit, an antioxidant benefit, and it just feeds the skin factors and peptides and materials that really enhance the overall functioning of the skin cells. And so sometimes when patients will use a growth factor product, you'll see a nice glow to their skin, even in a matter of days. And then antioxidants. It's important to feed the skin antioxidants, not just from the inside out, but certainly from the outside in, because the data on skin care and the data for antioxidants to have an effect on the skin is mostly in the topical form. So one of the most potent antioxidants for the skin is vitamin C. And so patients will often ask me, well, I take vitamin C, is that enough? And I say, yes, it's good for your overall health, but it's not really going to do a whole lot for, the skin directly. So vitamin C has multiple benefits for the skin. Its antioxidant effect has to do with its free radical damage, protective effect. And so that decreases cellular damage. And cellular damage occurs daily from UV exposure, from environmental factors. So it's protecting your skin from all of that. And vitamin C also has a strong effect in inhibiting overstimulation of the melanocytes. And the melanocytes, over time, as they age, starts to spill out that extra melanin, and that leads to melasma, or sort of that dreaded hyperpigmentation that often leads patients to say, my skin is so uneven, can you help me with that? So vitamin C helps with that. And there are other ways it helps as well, but those are the two most important. Vitamin E is an antioxidant for the skin. Coenzyme Q10 is an antioxidant for the skin. Green tea and polyphenols. These are the most common. And so sometimes even when patients, once they learn about these antioxidants, they will purchase these antioxidants even separately and make their own sort of cocktail. And it can actually make a great difference in enhancing the health of the skin. Now, the tip number 4 is that you want to make sure that you're not only caring for your face, that you're also caring for your neck and your hands. Often in skincare experts will tell you that they can tell a person's age by not necessarily looking at their face, but by looking at their neck and their hands. So my tip to all of my patients is that products that you're using on your face, if you can tolerate it, make sure you apply it to your neck as well and to the décolleté, so the chest on down. And then also make sure you just rub it on the back of your hands. So that's something I've been doing for years, and I plan to continue to do that. Sometimes if I demonstrate a product in the office for a patient, I'll take a little bit of that product and just rub it into my hands. But it's very important to make sure that you extend not only your skincare regimen for your face, but also make sure that you carry that to other areas of your skin that's highly exposed. And that includes the neck and the hands. So there are numerous products available. You don't necessarily have to buy a specific product for the neck if you can tolerate some of the skincare products on the neck. But I will say a caveat to that is that some products on the face may irritate on the neck. So you may have to buy a specific product, and there are numerous ones out there. Some of my favorites are, there's one called Revision Nectar Firm. There's a very good one from Neo-Cutis, and then there's a Neostrata neck tight and firming cream as well. Now those are professional skincare products where, for the most part, they're guaranteeing that you should see some type of skin tightening with those, but there are multiple products on the market as well. I tend to tell my patients, you don't necessarily have to buy a specific anti-aging hand cream. Just use what you're using on the face, on the back of your hands before you put on hand cream. And that's usually very effective. But if you want something specific, there are numerous anti-aging hand creams out there as well. And I can answer some specific questions about that when we have the Q&A session. So in summary, to maintain gorgeous, youthful skin for a lifetime, the first tip is to know your skin type. The second tip is to select a good, to wear sunscreen. And then the third tip is to select a good anti-aging product. I can help with that during the Q&A as well. And then the fourth tip is to pay attention to other areas of your skin that are highly visible as well, such as the neck and the hands. The next time, hopefully, if I get to participate in the Women's Confidence Tour again, I'd like to present on hair loss, because today I couldn't figure out if I should bring you anti-aging tips or if I should talk about hair loss, because hair loss has now become one of the most common complaints in my practice. And so I really wanted to focus a little bit on that because I think it's becoming an epidemic, particularly among African-American women. 2/3 of women are experiencing hair loss or will experience hair loss in their lifetime. But I'm finding that, the numbers may be growing, and I just like a lot of other dermatologists am becoming concerned about that. So if you have any questions about that, as well as the anti-aging tips that I brought for you today, then just let me know. Thank you very much.
Thank you so much for that presentation. I know that I grabbed my retinol and we were putting it on our hands. I was like, we didn't know. So thank you so much for all the tips, and we're looking so forward to the Q&A. I'm sure we're gonna have a lot of questions, and hopefully if you can write down some of those, some of the ingredients that you were talking about, that might be very helpful too, because I know I misspelled a lot.
Absolutely. I'm gonna put some of that in the chat for you, okay?
Thank you so much.
My pleasure.